All right, let's get right into it. If you've ever had a kidney stone, or even just know someone who has, you've probably heard the stories. The pain is, well, it's legendary. But how do doctors go from a person in absolute agony to finding a tiny little mineral deposit causing all that chaos? Well, in this explainer, we're going to break down that exact journey, step by step.
Yeah, a pain unlike any other is maybe putting it mildly. It usually hits you out of nowhere, and it's often described as one of the worst pains a human can possibly experience. It's your body's way of screaming that something is seriously, seriously wrong. And really, that intense pain is the first massive clue that kicks off this whole diagnostic mystery.
So that's the million-dollar question, isn't it? It's basically a medical whodunit. Think of the doctors as detectives. They have to gather all these clues from your body and use some pretty sophisticated high-tech gadgets to track down the culprit. So let's follow the evidence, starting right from the moment a patient walks through the emergency room doors.
Okay, so picture this. The story almost always kicks off in the exact same place, the emergency room. You've got a patient in just incredible distress, and the first order of business is to get that pain under control. But at the exact same time, the investigation has already begun.
The initial clues? They start rolling in immediately. Doctors are on the lookout for this classic trifecta, that horrible flank pain, which is often paired with vomiting and sometimes a fever. But you know, the real alarm bells start ringing with those red flags at the bottom. A high fever, or finding out the patient only has one kidney? Whoa, that immediately escalates the situation from just serious to absolutely critical.
So once they've got a handle on the symptoms and the patient's history, it's time to actually look inside. And what's the first tool they reach for? Yep, almost always, it's the ultrasound.
But why start with an ultrasound? Well, it's pretty simple. It's the perfect screening tool. For starters, it's completely safe. We're talking zero radiation. It's also pretty inexpensive, and you can do it again and again if you need to. It's great at finding stones in some key spots, and, this is crucial, it can spot any swelling in the urinary tract, which is a massive red flag for a blockage.
Okay, but here's the kicker. When a stone has moved down into the ureter, that's the tiny tube connecting your kidney to your bladder, an ultrasound only has about a 45% chance of actually finding it. Let that sink in for a second. It misses the stone more often than it finds it. So while it's a fantastic starting point, a lot of the time, the mystery is far from solved.
Right, so when that first look with the ultrasound just isn't cutting it, and there are still questions, it's time to bring out the big guns. And that means a CT scan.
Now, to be specific, we're talking about something called a non-contrast enhanced CT, or NCCT for short. And let me tell you, this is the undisputed champion, the gold standard for diagnosing kidney stones today. It gives this incredible, super detailed, almost three-dimensional picture of your entire urinary system. And that non-contrast part, that's really important. It means you don't need any special dye injected into your veins, which makes the whole process faster and a heck of a lot safer in an emergency.
So let's put them head to head. You can see the difference right here. Think of the ultrasound as your quick, safe, first-pass screener. But the NCCT, that's what gives you the final answer, the definitive diagnosis. It's way more accurate, and it gives you all these crucial details that the ultrasound just can't see. The stone's exact size, its precise location, and even its density, which helps doctors figure out the best way to treat it. The only trade-off, of course, is a small dose of radiation.
And look, this isn't just what some doctors happen to do, this is a strong recommendation spelled out right in the official guidelines. So the path forward is crystal clear. You start with the ultrasound, and if there's even a shadow of a doubt, you confirm with the non-contrast CT. It's the perfect 1-2 punch of safety and certainty.
Okay, so the imaging tells us where the culprit is hiding. But what about the why? Why did it form in the first place? And how is the rest of the body handling this whole ordeal? For that, we've got to look at the chemistry.
So yeah, every single patient in this situation is going to get their blood and urine tested stat. The urine test can spot things you can't see, like tiny amounts of blood, a dead giveaway that the stone is causing irritation, or it can pick up signs of an infection. And the blood tests? They are super important for checking how well the kidneys are functioning and for looking for other telltale signs of infection.
Now this next part, this might be one of the single most important steps for a patient's future. The official guidelines are really clear on this. If this is your first ever kidney stone, that stone must be analyzed, period. And the reason is simple, but it's huge. Finding out what that little stone is made of is the absolute secret to making sure you don't have to go through this ever again.
And this leads to some pretty unusual homework for the patient. Yeah, they actually have to filter their urine. It sounds a little weird, I know, but it's a really simple process. They give you a little strainer to catch the stone when it finally comes out. And trust me, getting your hands on even a tiny piece of it for analysis, it can change everything.
Okay, so we've got our standard diagnostic playbook, but you can't run the same play for everyone. For some patients, like pregnant women and kids, you've got to adapt the plan because safety is just on a whole other level.
When it comes to pregnancy, it is all about one thing: protecting the baby. That means avoiding radiation at all costs. So there's this tiered system. Step 1, always, is the ultrasound. No question about it. If that doesn't give a clear enough picture, they move to Step 2, an MRI, which is totally safe because it uses magnets, not radiation. A CT scan, even a low-dose one, is an absolute last resort. You only go there if the mother's health is in serious danger. And for kids, it's the exact same safety-first mentality. Everything is guided by this principle called ALARA. It basically just means using the absolute lowest amount of radiation you possibly can. So again, ultrasound is king. It's the first choice. But here's the really big difference for kids. Any child who gets a kidney stone gets a full metabolic workup. No exceptions. The risk of getting another one is just too high, so figuring out the why is non-negotiable.
So we've gone from the chaos of the ER through the high-tech world of radiology and into the lab. And now, finally, all the different pieces of this diagnostic puzzle start to click into place.
And there you have it, the complete modern diagnostic toolkit for kidney stones. You start with the ultrasound for that safe first look. You get the definitive answer from the non-contrast CT. You understand the body's reaction through blood and urine tests. And, most importantly for the future, you identify the root cause by analyzing the stone itself.
Because at the end of the day, getting the diagnosis, that's really only half the story. The real magic, the real power of this whole process comes from that final step, the stone analysis. That's what transforms a painful, miserable experience into a clear roadmap for the future. It gives us the answer to the one question that really matters. How do we make sure this never ever happens again?